Good afternoon. Hi. Yeah. It's a real privilege to be here, and I'm really, really grateful for the opportunity to speak to you all. So a big thanks to Angela for organising my being involved in this afternoon, and Sarah too, and thank you for inviting me. I guess there are three questions I would like to really explore with you. The first is, how do we respond to the challenges which face us in delivering care for people in our communities? And they are enormous challenges. And the second is, how can we ensure the health and well-being of the staff of this organisation who deliver that care? How can we promote their health and well-being? How can we ensure they flourish rather than languish as a result of their work? And third is, how can we develop new and improved ways of delivering services, because it seems like the only way we're going to be able to respond to the challenges is if we develop new and improved ways of delivering care for people in our communities. The most salient thing for me about the health service, actually about health and care, is that we're damaging the health and well-being of the people we ask to care for the health and well-being of others in the process. And that can't be right. You know, if our mission is to promote health and well-being, but actually we're damaging the health and well-being of our staff, that can't be right. Every year, something like 40% of NHS staff say that they've been unwell as a result of stress at work during the previous year. And in the most rigorous study to date of stress in the NHS, we found that 50% more staff in the NHS suffered from debilitating levels of work stress compared with people in the general working population as a whole. So about 27% of NHS staff scored above a cut-off point indicating minor psychiatric morbidity, compared with about 18% in the general working population. And we know that when people experience work stress, that chronically, it affects their ability to deliver high-quality care. It affects their ability to be compassionate. It affects error rates. And in the acute sector, we know that it's associated with higher levels of patient mortality. So I think it's a really important and really serious issue. I'll show you some data that reinforces that in terms of the importance for patients and service users. Now, it does raise the question then of, what are we to do? It certainly doesn't have to be this way, because there's variation between trusts in the extent to which they're able to reduce and sustain low levels of staff stress. So what are we to do? There are lots of national initiatives happening, as you know, system transformation partnerships, 5-year forward views, efficiency reviews, vanguards, and they're important initiatives, of course, but I don't think that they address the core cultural problems that we need to address, which are to do very often with either lack of leadership or poor leadership at every level of the sector. So I think we have to go back to the core of what healthcare is all about. When the NHS was set up, as you know, in 1948 by a deeply traumatized post-war society, it was with a commitment to provide high-quality care for everybody, regardless of wealth, status, prestige, demographic background. So it was set up based on core values of compassion and inclusion. And we've been fiercely protective of the NHS ever since. So it's constantly in our newspapers, it's on TV, because as a society, I think we are committed to being a compassionate society, and the NHS is the most visible form of that compassion. And all of you, and all of the other 2,500, 3,000 people who work in the Trust made a decision to dedicate an enormous part of your magical lives, your unique, precious, mysterious lives, to caring for your fellow human beings, to caring for your fellow people in your community. So you too, and all of those that you lead, embody a core work value of compassion. So I think we have to go back to understanding compassion. You know, for me, it's the healthcare assistant I saw who stayed for an hour after her shift had ended, holding the hand of an elderly lady who was in distress and talking to her lovingly and caringly until she was calm again. And the GP in Southwark who told me that she danced in her surgery that day with a lonely elderly man when she discovered they had a shared interest in dancing. They're beautiful examples, and I'm sure you see them every day around the Trust, the compassion that your colleagues show, that those you have the privilege of leading show. When we delve into compassion and to understand it, I think it has 4 really important components to it. So, what's your name?
Elaine.
Elaine. So if Elaine here is in distress, this is quite safe, I promise you. If Elaine is in distress, then in order for me to be compassionate, first I have to be present with you. I have to use Nancy Klein's wonderful phrase, listen to you with fascination. So to be present, to be here and now, to be open, empty of judgment. And second is, I have to arrive at understanding of the causes of your distress. And third is, I have to empathize. I have to feel your distress at some level without becoming overwhelmed by it. And then the fourth is, and that gives me the motivation for the fourth step, which is saying in my head or to you, how can I help? How can I serve you? So those 4 elements of compassion, attending, understanding, empathizing, and helping or serving. That makes sense? Feeling better already, Lynn? Yeah. And when NHS staff, when we provide compassionate care for patients, they are more satisfied. And that in turn has an impact on staff well-being and commitment. So we get virtuous cycles of compassion. And the challenge for us, given that we know that the most important factor shaping people's behavior in a community or an organization is culture, the challenge for us as leaders is how do we nurture cultures where staff can provide compassionate care, high quality compassionate care, consistent with the focus of the Trust. And in terms of culture, every interaction by every one of us every day shapes the culture of our organizations. Every interaction we have shapes the culture. If we're warm, if we're positive, if we're kind, if we're irritable, if we're preoccupied in our interactions, all of that shapes the culture. Basic civility has an impact on the culture. But the other factors that are most important are the founding values of an organization, which we've talked about, but also the leadership of an organization. Because what we as leaders pay attention to, what we talk about, what we reward, what we monitor, what we model in our behavior, tells people what it is that we value. Of course, what we invest our time and energy in, what we talk about, people infer from that what's important to us. And what we value, what leaders value, tells people what the culture is, because culture is what we value. So it seems to me that what we have to do is to ensure that the leadership of our health and care organizations models compassion through leadership and collectivity. That means leaders paying attention to those they lead, listening with fascination to those that we lead, being here and now with them. So one of the complaints I often hear from staff is, we only see our leaders when things go wrong. So it's about being present. And I believe the most important task of a leader, of any leader, is to listen, quite simply, to listen with fascination. And second is understanding the challenges that those we lead face. And ideally, that's not an imposed understanding, that's arriving at a shared understanding. We may disagree, but to work through to a shared understanding of the challenges that they face in delivering care for people in the community. Because a shared understanding will be more accurate and more helpful. And third, it's then empathizing with staff, feeling for and with them. Given the data I talked about at the beginning, that feels really important, that we should be empathizing with them in terms of the challenges that they face. And that gives us the motivation for the fourth step as a leader, which is to ask the question, okay, how can I serve here? How can I help? How can I enable the people I lead to find solutions to the challenges they face? So those four behaviors, leadership behaviors, I think are really simple to remember, but very powerful, of attending to those. Because, and by the way, the fourth one's important because sometimes NHS staff, what we hear them say is, well, yeah, the board members are really good at coming round and talking to us, but nothing ever changes. They're really good at listening, but nothing ever changes as a consequence. So, you know, what's important about compassion is it's not just being empathic, it's also about seeking to serve or to help. You know, the good news is as well that there is national support for collective compassionate leadership. A year ago, just over a year ago, the 12 national bodies that oversee the NHS. There's a nonsense. It is a nonsense. It just creates so much work, and successive inquiries have said we need to minimize the number of bodies that are overseeing the NHS to ensure simplicity and alignment. But those 12 national bodies, plus Skills for Care in the social care sector, sponsored a new national framework on leadership development and improvement, focused around collective compassionate leadership at all levels, and also with the development of improvement skills across the whole system. And importantly, I think they made a pledge to model that collective, compassionate, inclusive leadership within their own organizations and in their interactions with the provider community and the commissioning community. You may have a question in your head, as I've got one in mine, you know, something around, will I believe that when I see it, sort of question. This morning I was at the King's Fund at a conference of chief nursing officers, and Jane Cummings, the chief nurse, was saying that in NHS England they're now beginning a process of culture transformation consistent with this. NHS Improvement are beginning to look at their culture and leadership. And I have to say that these national bodies are in desperate need of that work, because if you look at their staff surveys, they are dire. They are dreadful in terms of the way they're functioning. And it's not just a matter of they should be practicing what they preach, but if they're not functioning as healthy organizations, they won't be effective in supporting the entire system. So I think it's really important that we're all aware of those pledges, and when we have interactions with people from the national bodies, that we play back to them their commitment to collective, compassionate and inclusive leadership. Does that make sense? Great. So that's both, I think, firstly, you know, it's about this core approach to leadership, which I don't think is difficult to remember, those four behaviors. If we practice those, we make a difference to the culture. And it's recognizing as well that it's not just a local initiative, but there's national support for this approach, which is encouraging. So what I'd like to do now is spend a little time talking about what, as leaders, it feels really important that we focus on if we're to ensure the delivery of high quality care. And so I'll say a little bit about what we know about the key cultural elements in healthcare organizations that consistently deliver high quality care. And then we'll have some time for discussion around tables and questions so that you won't be put to sleep by me gabbling on all afternoon. So over the years, a good deal of research has been conducted within the NHS, which has given us a really clear insight into what are the important characteristics of trusts that deliver consistently high quality care. And if we know what those characteristics are, then that tells us as leaders what we should be focusing on every day in our work. You know, if these are the key elements of the culture, then that's where we should be focusing our energies. There's so much stuff to do. It's about how do we ensure that as leaders we're really focused on what's important. And there are 5 areas that I want to talk about that kind of all fit together in an integrated whole.